Well, good afternoon, everyone, and thank you for joining us for this year's Austin Public Health HIV Resources Administration Unit Subrecipient Technical Assistance Monitoring webinar. So if this is not where you thought you are more than welcome to stay with us. If you are here for this meeting, if you would not mind dropping your name, the agency that you are with in the chat so that we can be sure to have a good collection item of names so that we can be sure that people are here with us. And just as a quick reminder, we do record this meeting so that if you or another staff member needs to go back and recall what was said during the meeting, or just as a refresher for someone who was not able to join us today, we will make this available to everyone for reference at a later time. And again, thank you all for joining us. And I'm going to turn it over to my colleague, Michael Coran.
Hello, everyone. My name is Michael Coran, and I work with Collaborative Research. Many of you know me from past years. We do our monitoring here in Austin. I am an Austinite myself. Collaborative Research is a consultant to the Austin Public Health HIV Resources Administration Unit, and we will conduct our annual comprehensive monitoring site visits for funded subrecipients to test compliance with fiscal, programmatic, and universal standards. As you just spoke to Thomas Rodriguez-Shucker, I am Michael Coran. On the line, I also have my colleagues Derek Jackson.
Hello, I'm Derek Jackson.
And Sarah Seberg.
Hi, everyone. Sarah Seberg with Collaborative Research.
Would we like to pass it over to the recipient's office, Ken?
Good afternoon. Thank you all for being here. This is, of course, very important that we get the monitoring done. We're doing it a little bit earlier than last year because we have a site visit with HRSA coming in the spring. So we wanted to get this done and out of the way before that happened. Thank you all for participating, and collaborative research is wonderful, as most of you know, and they will provide all that you need for this monitoring, at least. And if I don't get another chance, happy Thanksgiving, everyone.
Ken, do you want to introduce anyone else on your team?
Let's see who is here. Raju is our research analyst. Raju, you want to introduce yourself?
Sure. Thank you, Ken. Thank you, everyone. My name is Raju Kemire. I'm research analyst working at HIV Resources Administration Unit, Austin Public Health. Thank you. And I'm going to pass it over to Sherry Lales. She's our data manager. Hi, Sherry.
Hello. Hi. Let me see if I could turn my camera on. Oh, there it is. My name is Sherry Lyles. I'm the data manager for the HIV Resources Administration Unit. Thank you. And I'll pass it over to Jennifer. I think should be on the call. Let me see.
I don't see her.
I don't either. I don't see anybody else. That might be everybody that's on the.
I think that's it.
Okay, that's all of us today.
All right, Thomas, if you want to pull the PowerPoint back up for me, please. Next slide, please. All right, here's our 2022 monitoring process. As we've done in the past, we will be doing our fiscal monitoring review virtually. This will all be an FTP site upload. we will utilize the HRSA and HAB fiscal monitoring standards. And when necessary, this will include interviews with the subrecipient fiscal staff to review compliance. This is if you uploaded something that we're unsure of, or we just have any questions, we just may want to schedule a follow-up interview with you. Our universal monitoring review will also be done virtually as well with an FTP upload. This will also utilize the HRSA HAB universal monitoring standards, and same with that. If we have any follow-ups, we will schedule an interview with the subrecipient program staff to review the compliance. And finally, the fun part, our service category chart reviews. This will all be done via Zoom, so it will be virtual, and we will utilize the Austin HIV Service Performances Catalog, Service Standards, and HRSA and HAB Programmatic Monitoring Standards to test compliance for each service category. Next slide, please, Thomas. Thank you. For our fiscal monitoring, all of my fiscal friends in here, this is your slides. The fiscal period of review, we will have reimbursement requests for the month of January 2022, and those will be reviewed for compliance with the Uniform Administrative Requirements and Cost Principles, 2 CFR 200, 45 CFR 75, and HAB program letters. Subrecipients are encouraged to review the fiscal monitoring tool to understand requirements for demonstrating compliance with each performance measure. Upload documents to the FTP site. Subrecipients are required to upload compliance documents to the Collaborative Research FTP site for review. Please upload all documents by January 13th, 2023. Please do not wait to upload all documents until January 13th, 2023. If necessary, the subrecipients will be required to designate a knowledgeable staff member to participate in a fiscal monitoring interview with the CR team. Subrecipients will demonstrate compliance to fiscal policies and procedures and answer questions from the monitoring team. This is in case you upload something that we aren't able to follow or not sure if it answers the questions that are proposed in the fiscal tool. But we will go on to the FTP site to explain that later. Fiscal monitoring requirements include limitations of use, unallowable costs, income from fees, imposition and assessments of client charges, financial management, property standards, cost principles, auditing requirements, and fiscal procedures. Documents used for compliance in each of the above sections should be uploaded to the FTP site for review. Next, we'll look at an example of the fiscal tool. So this year we have updated our fiscal monitoring tool to reflect each of those sections. So they'll be broken down into color coordinated areas for subcontractor services, time and effort. And in these questions, so it will say exactly what we require for you to upload to the FTP site. So if you answered, do you have subcontractors, including contract employees funded by Ryan White? If you check yes in the fiscal monitoring tool, you will be required to upload a list of active subcontractors along with the annual budget for each service provider.
And Mike, let me hop in there really quickly. So this looks very different from what we have done in years past. So what we've tried to do is, since HRSA HAB has updated their national monitoring standards, we've tried to align it and look a little more compliant with what HRSA HAB is requiring. So in past years, if you remember the universal and fiscal monitoring tools, those were kind of in a table format across, I think, 12 or 13 pages. If you look at the new national monitoring standards, it's a conglomeration of about 100 pages that explains kind of everything. And so even in years past, we've experienced that there were tons of questions about what does access to care mean? What am I supposed to be uploading to this section? And so we only had a section A, B, C, or D, etc. And we were just dumping all those documents in there. And to be quite honest, I don't know if anybody besides myself was a little overwhelmed by going back through those documents when we were looking at that. But I was like, you know, Emily, I'm gonna pick on you because you're the first person I see. Like, did Emily mean I should be using this document for this question, or should I be using this document? So it's very hard for us to say, you know, which document did you want me to look at for compliance to that? So we've broken those questions down in a little easier way to do it. And so when you go into the FTP site this year, you'll see in a little bit, you'll see fiscal monitoring question number 42. folder, and that's where where you upload compliance documents for each specific question. So we're hoping that while it may be a heavy lift, it will be a little easier in kind of looking at where those documents go. And if you have been with us in the past, you will have access to your previous year's folders if your email address has not changed. And if for any reason you or a new staff member needs access to those previous year's folders, you'll just let us know and we'll make sure they're able to get into those previous years to kind of look at policies and procedures, etc. All right, Mike, you turn it back to you, sir.
Okay, next slide, please, sir. All right, moving on to universal monitoring. Subrecipients are asked to complete the universal monitoring tool and upload the tool and supported documentation to the respective folders in the FTP site. Subrecipients are required to upload compliance documents to the Collaborative Research FTP site for review by January 13th, 2023. Please do not wait until January 13th, 2023 to try to upload things. If necessary, the subrecipients will be required to designate a knowledgeable staff member to participate in a universal monitoring interview with the CR team. Subrecipients will demonstrate compliance to the universal policies and procedures and answer questions from the monitoring team. Universal monitoring requirements include access to care, eligibility determination, anti-kickback statute, and salary cap limits. Documents used for compliance in each of the above sections should be uploaded to the FTP site for review. This is an example of our universal tool. So we have also upgraded this tool to make it easier and more prescribed with what we need to see in our monitoring. So in the original questions, in the first questions rather, it will ask you if your organization provides any of these services or service categories: EIS, HIPSCA, medical case management, legal services. If so, you please show what part you are funded under for these service categories. And if you answer yes to these questions, these are everything that we would like to see uploaded to the FTP site. Next slide, Thomas.
I'll jump in here really quickly as well. So this also looks a little different from previous years in that this is more of a programmatic compliance that HRSA has outlined a lot better and what is expected of subrecipients who provides particular services. I don't, it's not up here, but transportation does have a laundry list of items that they are required. Some of those may not be relevant to you, and you would just simply not click the yes button to that. So for instance, let's say we'll use EIS. Well, those are all applicable, but under transportation, it'd be like, do you use rideshare programs? Do you use an agency van? Do you do reimbursement for mileage? So, you know, you would just look at those particular items that may or may not, and you would just simply click yes or no to the entire question.
Here is another example for the access to care section. Just like we said with the fiscal monitoring tool, our universal monitoring tool, if you answer yes to any of these questions, it specifically asks you what we want to see uploaded to the FTP site. Thomas? FTP site access and uploads. Subrecipient staff is responsible to uploading and reviewing compliance documents for fiscal and universal monitoring will need to request access to the FTP site. A link to request access to the FTP site will be included in the site visit monitoring email. The FTP site is a web-based and HIPAA compliant service. However, you should not upload any patient private health information to the FTP site. Please note that no access will be granted after January 6, 2023 to the FTP site. Please make sure to request access for the FTP site before January 6, 2023. Also, please note, it will take 24 to 48 hours to receive your access to the FTP site. So if you apply for it, do not expect it to be delivered immediately. When uploading compliance documents, many questions in both the fiscal and universal monitoring tools will require subrecipient staff to upload compliance documents. The FTP site is set up to align directly with the monitoring tools. For example, if you're planning to upload compliance documents to question 10 in the fiscal monitoring tool, you will simply drag and drop the compliance documents into the FTP site under the folders Fiscal Question 10. If the question is not applicable to your organization, you will choose the no answer on the tool and move on to the next question. FTP site. Once you have received your credentials to access the FTP site, you will be able to log in. This is an example of the login screen. So as a reminder, do not share your login credentials. If you have additional staff who need access, they too should request access to the FTP site. Okay, so this is what Thomas was talking about with the folders earlier. So when you log into the FTP site, this is what your screen will look like. You will click on the folder for your organization, and then it will show you fiscal or universal. You will be required to upload the completed fiscal tool, and then any of the data that supplements your questions. So for question number 10, you would need to upload revenue and expenses. Please upload all of that data to supplement your question. The file structure will be divided into fiscal and universal folders, and the question folders correlate to the tool. Simply drag and drop into the question folder to upload your documents. Service category chart review. Subrecipients are encouraged to review the TGA service standards, PCN 1602, the national monitoring standards, and the monitoring tools to understand requirements for demonstrating compliance with each performance measure for each funded service category. Virtual monitoring will begin with an entrance interview and conclude with an exit conference. Leadership and program staff should be present at both entrance and exit when available. We understand sometimes we might finish early and you might be in a separate meeting. It's okay. We will relay the information to you if you are not available for the exit conference. During the on-site monitoring, subrecipients should designate a knowledgeable staff member to be available as a point of contact for the monitoring team. Chart pull and sampling methodology. This is the sample size guidelines for the Austin TGA monitoring. So we have reached out to Raju from the recipient's office to provide us an unduplicated client chart for each organization for their services provided. So if your unduplicated clients are between 1 and 24, we will be reviewing 100% of the files. If your unduplicated client chart for that service category is between 25 and 50 charts, we will review 25 of the charts. If your unduplicated client chart is between 51 and 100, we will be reviewing 30 randomized charts. If there are between 100 and 499, we will be reviewing 40 randomized charts. If you provide services to above 500 clients, so let's say, I believe medical case management and non-medical, we have seen this in both of them. We will only be reviewing 50 random charts from the sample size. Chart monitoring components. As I said, we will be doing a mini entrance interview, which will give the subrecipient and the CR monitoring team time to introduce themselves, and a brief discussion of the strengths and challenges with the service delivery for the service category being monitored. CR will conduct a mini entrance interview for each service category being monitored. Exit interview. Once each service category has been reviewed for a subrecipient, we will schedule an exit interview to present our overall outcomes of the monitoring visit. The outcomes will include high-level data gathered during the chart monitoring process. Here's an example of what our chart monitoring tool looks like. So it's real straight to the point. For eligibility, we'll be asking about these things such as status, income, residency, and insurance status. Aubrey, I see your question. Thomas, will you please go back one slide? Or 2 slides, sorry. So if there's over 500 clients in the service category, we will be reviewing 50 of the charts. Is that okay, Aubrey?
Yeah, sorry, it's when the pop-up in Zoom just covers the bottom part.
No problem.
This,
I've got the
of the
meeting
slide,
chat.
so 50
and then
to
everyone
100.
screens.
Oh, I see, 100 to 499. Thank you.
You're welcome. All right, Thomas, can we go back, please? Thank you. Chart monitoring tool. Okay, so we will be, for eligibility, we will be looking for proof of status, proof of income, proof of residency, and then proof of insurance status. We will also be looking to see, we'll be monitoring viral suppression rate with the charts that are monitored. So we'll be asking for the, if the client is virally suppressed and the viral load. If there's documentation of 6-month recertification in the client chart, and did the client have initial assessment? So this was the example for medical case management. With certain things being through EMRs and us not being physically there to dig through your EMRs, we will be using the dates of certain items, such as recertification dates or dates of, why can't I think of
Care
Thomas?
plans.
Care
Or
plans and influenza vaccines, vaccinations. So we'll be using those dates as well to kind of own that we've reviewed those charts.
And so one thing that we will not ask you to do is share, if you are utilizing, well, we will not ask you to share your screen to show compliance documents. We want to minimize as any perceived HIPAA violations that could possibly happen. And first and foremost, you don't know who's sitting here with us as monitors. And so that could be perceived as a HIPAA violation. So that's why we're asking for a lot of dates. And, you know, using our best common sense, I would say, for those questions that seem to be, for instance, this is a great question. Initial assessment completed within 30 calendar days. We will not be asking you to go back to 2007 to figure out when Thomas's first initial enrollment into medical case management was. And so some of these questions are very specific to new clients, right? And so we'll ask you, is this client new in 2021 or whatever that time period is for that particular grant? And if you say no, and you'll see here, X, not new, we'll make notes that we are definitely not going to ask you to go back to 2007 or beyond. So they would need to be new. So as you're reading through the monitoring tools, if those questions seem like, wow, they're asking for me to go all the way back to figure out when he was originally enrolled, that's not what we will be doing. That would be specific to just new clients. And then I'd also like to point out that when you do have these monitoring tools, this is a great opportunity to kind of initiate a process internally within your own organizations of completing either a supervisor's review or a 10% chart pool list on a regular basis, just to kind of give you an idea of what we're looking for. We're not asking you to tailor your services directly to the monitoring tool, but to make sure that you are documenting the questions that will be coming forward in the monitoring visit for that particular year.
All right, monitoring site visit reports. Subrecipients can expect to have final monitoring reports 30 days from the last monitoring visit. Subrecipients who are required to submit a corrective action plan will need to do so within 20 business days from receipt of the final monitoring report. The outcomes of the site visit will be annotated using 3 categories: satisfactory, requires improvement, or finding and corrective action. Satisfactory performance measures that are deemed satisfactory will require no further action from the subrecipient. Requires improvements will require a quality improvement project, and finding a corrective action will require a corrective action plan to be submitted to the recipient's office. All right, now I know what you've all been waiting for, our chart monitoring schedule. Coming up first, on Tuesday, December 13th, we will have project transitions in the afternoon with Derek Jackson. On December 13th as well, I will be working with Ashwell to go through your monitoring. On Wednesday, December 14th, we will be working with ATCIC. Also on December 14th, I will be working with David Powell, and Thomas Rodriguez-Shucker will be working with Community Action. On Thursday, December 15th, Derek will be working with Vivent Health. We'll be starting with Vivent. I will be finishing up David Powell on Thursday. Thomas will also be working with Vivent on that day. And on Friday, Thomas, next slide.
Excuse me, Michael,
Yes, ma'am.
could you go back one slide, please? Okay, we're just trying to get the date for Ashwell.
Tuesday, December 13th from 10 a.m. to 5 p.m.
Okay, thank you.
No problem, ma'am. Thomas, 2 slides forward, please. And on Friday, Vivent will be seeing Thomas and myself to finish up. And Waterloo Counseling Center or Texas Health Action will be working with Derek Jackson in the morning. Sorry, Derek. And in the afternoon, AHF, AIDS Healthcare Foundation, will be working with Derek as well. Monitoring packets. Collaborative Research will distribute monitoring packets to each subrecipient by December 2nd, 2022. Monitoring packets will include the official notice of intent to conduct the annual site visit, a site visit schedule, the CR team members assigned to conduct the on-site monitoring, the monitoring tools, and the instruction document for uploading to the FTP site. Hi, Astrid. I see your question. AHF, I believe, is only EAG. That is what we were notified through the funding matrix from the recipient's office. You're welcome. Chart pull list. The recipient's office will provide to each subrecipient a list of random charts to be monitored by service category. Subrecipients can expect the chart pull list at least 5 business days prior to the scheduled visit. FTP site uploads. I cannot hammer this home anymore. Access must be requested before January 6, 2023. Subrecipients should complete the FTP site uploads of compliance documents no later than Friday, January 13th, 2023. Friday, January 13th, 2023, we will not be able to help everyone who has not uploaded already. So please do not hit us at 4:55 p.m. on Friday, January 13th with your problems. Please contact us prior to that. Thank you. If needed, CR in concert with the recipient's office will coordinate with the subrecipient a date and time to conduct a one-on-one interview for fiscal and universal monitoring. Yahira, I see your question in there. David Powell's EHE funding will be monitored on the same day as your site visit. Yep, that will be on Wednesday, December 14th or Thursday, December 15th, depending on which day we can fit it in. You're welcome. Raju, I see I will provide the number of client service for PS20 HIV. Gotcha. All right. If there are any other questions, now is the time. Please feel free to raise your hand in the chat function or just type your question into the chat.
When can we get the tool?
Hi, Michael, when can we get the tool, the monitoring tool?
As I said, that will be going out with the monitoring packet.
Okay. And could you go back again with the timeline of the agencies that you're going to be monitoring, those dates? Okay.
You guys are still Tuesday, December 13th.
Right. I'm just looking at the service. Thank you.
Todd, we are monitoring the 2021-2022 grant year. So for fiscal, we will be asking for January 2022. Zara, yes, I will send out these slides along with the monitoring packets. Chris Adams, I received your question. Thank you. Aubrey, if we had access to uploading the FTP last time, we do not need to do anything. Yes, ma'am. Or Thomas?
Yes, you, excuse me. So those accesses will not allow you into this year's document. So you will need to request access again and agree to the terms and conditions of the FTP site. Once you do that, you'll still use probably the same credential being your email address unless your email address has changed. We have had that happen a couple of times. Do not fret if that happens and you're trying to access previous year's documents. Simply shoot us an email and we will make sure that you can get into those. And that goes for any new staff that you may have as well who will need access to previous year's documents. And so, Mikey, I might just look at trying to update well, no, we'll prefer that you email us to ask for previous year's access if you don't mind. But yes, everybody will have to request access. Instructions for utilizing the FTP site will go out in the monitoring packet as well as gaining access to the FTP site.
Madge, I will be sending out the recording of this presentation along with the monitoring packets. Aubrey, will we be sending instructions? Yes, that will also be in the monitoring packet and in this PowerPoint.
And Mike, if you don't mind, if you could, well, can I copy screen? Oh, and now the closed captions on. If you can drop your email address into the chat so that people could make reference of that or copy and paste it and save it to there, that would be great, please. Now stop sharing. Are there any other questions or concerns? And just as we state every year, this monitoring visit is not an aha, we got you type of moment. This is an opportunity for the recipient's office to determine compliance with documents. We know you're doing an amazing job. We see the care continuum dashboards. So we see what the results of those are. We just have to put it on paper so that HRSA believes us that we're doing this, right? And so also, if this will give you an opportunity for quality improvement projects and looking at some, what I call low-hanging fruit. So if by chance you were to get something in return in a corrective action plan or an opportunity for improvement, there you go. You've already, unfortunately, created a quality improvement project for yourself, but you know, it's a simple fix in that you can increase those efficiencies along that service delivery line. So this is a great opportunity to look at some of those as well. All right, we'll kick it back to the recipient's office. Any announcements from the recipient's office that you would like to make at this time, sir? Ken, Raju, or Sherry? If Sherry's still with us as well.
I do not have any announcements.
All right, great. Mike, anything else from you, sir?
No, sir.
All right, we'll be looking.
One last
ahead,
thing, sorry, Thomas. One last thing, when you get your confirmation of being admitted into the FTP site, please check your passwords right away. Sign into the FTP site, just be familiar with it.
Glad you said that, thank you.
As you know, we do this in many other jurisdictions. And we always have the same issues where people sign up for the FTP site and then forget about it in their email and they never log in. And then the day of uploading, we have plenty of fires to put out. So let's just test our emails and passwords as soon as we get them, please.
Sure. And then keep in mind, I just wanted to point this out as well. When you receive your password, you're going to get a very cookie cutter email from me that's going to say your access to the FTP site has been approved. Your login is your email address that you provided, and your password is going to come from a separate email through Arcus or GlobalScape, right? And so please check your spam. If you're new or we reset your password and you go to log in with the password that you're provided and it says, hey, you got to reset your password. Just a word to the wise. It has a very particular HIPAA compliant format it needs to be in. I simply always just added 1 to the end of the password it gives me. If you try to copy and paste, if you're having that issue, always look to see if there's a space after your email address or a space after the password. But sometimes when you copy and paste, there's that blank spot you do not see. So if your cursor is flashing like 1 spot past your email address or 1 spot past that password, try to back that out. Again, we're always here to help, but just some quick pointers. And you can always click on forgot password. So that's a great option as well, so that it will automatically reset your password and send that to you that way too. So I see Aubrey says, can you confirm that I understand you will be looking at dates, not content of actual documents to avoid potential HIPAA violations for all documents? So that's specifically, Aubrey, for chart compliance documents. So we will not be looking at those, but we will rely on your staff to be looking for those as we go through the monitoring process and provide us the dates of particular items that we may be looking for from that form or document that you're utilizing for compliance.
So like in OAHS, we will not be looking directly into your EMR, but we will be asking for the dates of vaccinations. For case management, we will be looking for the dates of care plans. We will not be reading through the care plans. We will not ask you to read all of your care plans to us, but we will ask for the date of the initial care plan for that grant year and then the update, which it should be within 6 months.
So we really do rely on you to kind of be the eyes and ears for that. So if we ask you like, for instance, your care plan contained the required documentation, whether that be a referral or an assessment or, in a PHQ2 or PHQ9 or things of that nature, we really do rely on you to be honest with us that is actually there. So great questions, though. Are there any other questions? All right, well, again, on behalf of the recipient's office and collaborative research, we are looking forward to another successful year of monitoring and getting to know. I see lots of faces I've seen and names I've seen in the past, so looking forward to working with you again. And for those of you who are new, looking forward to working with you and hope that this is as seamless process as possible. Again, our main goal in this is getting you back to patient care because that's what matters. So we do not want to spend as much time as we would like to, but try to get this done as succinct as possible. So we hope that each and every one of you have an amazing holiday. Please be safe, and we will have out monitoring packets by Friday, December the 2nd. If there are no other questions, we will end the call.
Thank you for your time, everyone. Ken and Raju, would you mind staying on for a second after?
Sure. Thank you.
Thank you, everyone.